All right. Hi, Leslie.
How are you, Remy?
I'm doing great. I am going to just put this in the chat box and pin it to the top and give everybody just a second to settle in here. All righty. Well, it is right at 6:30, so we will get started. Just a couple of kind of housekeeping notes. First of all, I am Remy. It's nice to have you guys here. I graduated from UNCA about 10 years ago with a bachelor's degree in psychology, and since then have taken a little bit of a detour into the wellness route. And I've been a massage therapist and a yoga teacher and a health coach, and recently decided to go back to graduate school and get my master's degree in clinical mental health counseling, which is where Leslie and I met, and also hi, Lashika. And so we are getting our master's in clinical mental health counseling, and we are a part of an internship group where we are working with house call counseling. I've actually just put that link in the chat box over there. So if you at some point during this webinar are curious about scheduling, that's where you would go to do that. House call counseling is really cool in that you can schedule a consultation in less than a minute and choose a counselor to see. It can oftentimes be much more involved than that. So we try to make it as easy as possible for folks to be able to do that. Uh, Also, if you are here from the community of Catawba College, there is health services on campus that you can go through also to receive mental health counseling through the Student Health Center. Is that the Student Health Center, or is it a different?
Yeah, so it's part of Student Affairs, and they have a counseling resource center available for students free of charge. You can go once a week. They have a handful of different counselors that you can see there, and it's right in the middle of campus, so it's easy to find. And also, it's worth noting, even though we are not associated through house call counseling with Catawba, students there can also reach out to house call. Like Remy said, it's really easy and it's very accessible.
Absolutely. So just a couple housekeeping things. If you feel comfortable and you would like to have your camera on, you're more than welcome to do so. I'll just ask that you guys keep your microphones muted during most of the webinar, just so you don't get a bunch of cross noise going on. And we'll kind of wait until the end, but you guys will have an opportunity to unmute yourselves and ask some questions verbally if you'd like, but you're more than welcome to, if we're talking about something or you have a question and don't want to forget it, to just drop it in the chat box and we'll be looking in there as well during that time. As you may have noticed when you logged on, we're also recording this so that we can have it on the House Call Counseling website later for reference for those who may be interested in some of these
Mhm.
questions and want to have a place to find some of this information. So, Leslie, would you like to introduce yourself and say who you are?
Sure. So, like Remy said, we are students at Catawba College in the health science department studying clinical mental health counseling. I also have a little bit of a different background. I have a master's in fine arts with a minor in art history, and I worked in the education field after graduation. I also have taught yoga, so Remy and I sort of share that passion with one another. And then also have been a stay-at-home parent for some time. I found myself as my children are getting a little older, I had a little extra time on my hands and working with people, teaching, education, psychology, all of those are just natural interests of mine. And so counseling seemed to be a really interesting place where all of those loves of mine overlapped. So here I am. And I'm just really excited to be here tonight. We appreciate you guys joining us, and we look forward to sharing what we know so far with you guys.
And really, this is meant to be somewhat informal and giving
Mhm,
you guys an opportunity to learn a little bit more about the process of
mhm.
counseling and what that's like. And really, if you have any questions, we're more than open to hear from you as well. So, just kind of kicking it off, what is it to find a counselor? How do you do that? There's a bunch of different ways that that can happen. Again, we've got our link in the chat box there. If you are curious about house call counseling, that's definitely one way, but kind of all roads can lead to Rome. So you can always go through word of mouth, a student health service, if those things are available to you. Uh, Leslie, do you have anything you want to add on that particular topic?
Sure. So from my personal experience, talking, like Remy said, to people that word of mouth, people that have had good experiences with counselors, it can also be helpful to talk to your primary care physician or anyone else that you're seeing in professional capacity. I have found typically that those people have a resource list at the ready. And so that might just be a good starting point, depending on what you're looking for, if you have an idea of what you want. But yeah, I think there's a lot of ways out there to sort of search around, talk to people, and then, get a reference from either someone that that's had that experience with a counselor or an agency that has a recommendation.
Absolutely. So, one of the things that I think is a really interesting thing that doesn't have a one size fits all answer is when is the right time to start counseling? So that can actually look different for a lot of different folks.
Mhm,
Some people kind of wait until they're at that point where they're like almost at that breaking point and they're like, I really, I think I might need to talk to somebody, or they've kind of
mhm,
passed that breaking point and then almost kind of doing some cleanup and aftermath work on that. And one of the things that I wish that more people knew is that you definitely don't have to wait until you're at that point to find a counselor. In fact, it can
mhm.
actually be really beneficial to have that resource in your pocket before you even feel like you need it. Um, Leslie, anything on that?
So just to piggyback on that, I totally agree with what Remy said. I think that a lot of folks have a sort of preconceived notion that therapy is for when people are broken or have something wrong with them. Maybe they're at a critical mass point in their life. And the truth is, I think everybody could benefit from therapy in some way, shape, or form. Um, like Remy said, it could be really beneficial to check in with someone and get started in that relationship when you're kind of not at critical mass. So they have a baseline of who you are and what's important to you. Um, one of the questions that we sort of talked about in that too is like, are you ready for counseling? It is a very personal decision on when and if to enter counseling, but I think part of our goal, like as new counselors, is to provide education and sort of help remove some of the stigma that can be attached to therapy in general and counseling.
Yeah, and moving forward with that idea too, that people go to counseling for so many different things. Like
Mhm,
everybody doesn't enter counseling with the same goal or having come from the same place or even having reached a critical mass. I think that one of the best experiences that I've gotten through therapy and
mhm,
now get to be kind of on the other side of is being able to have the tools to get to know my own mind better so that
mhm,
when life inevitably comes at you fast or you get a curveball, that you have these tools that have already been established that you can kind of wait until you need some of them, but you
mhm,
always know that you are capable and have that set of resources or tools for you because life is stressful. There's no
mhm.
way around that. It's just always
Right.
going to throw you something you don't expect, and to have the confidence in knowing how you handle communication when things aren't going your way, or to have the
Mhm,
confidence in being able to say like, when I'm not at my best, I at least know I have these things to turn to. So people go to counseling for interpersonal relationships, like
mhm,
maybe marriages or friendships or parent relationships. But it can also be because you just want things to be better. I'm actually really like fascinated with this concept of enrichment counseling, that, things don't have to be wrong, but you can be in a place in your life where you kind of feel like maybe you're not as engaged as you would like to be, or you're not finding the joy in the same way that you have in the past because your life circumstance is different, and you want to be able to experience yourself in this new capacity of life in a way that feels more authentic and connected to who you are. So that's another way or reason that somebody might even enter into counseling.
Right. And just to follow up with what Remy said, both of us happen to be, yoga teachers. And one of the reasons I think many people go to yoga teacher training is to sort of deepen their own personal practice. And I find that with counseling too. I've been a person who has utilized counseling for 20 years on and off throughout different transition points in my life. And I feel like it's just a way to sort of find a deeper connection with yourself. And there's also just many benefits that come along with counseling. Like Remy mentioned, interpersonal relationships. That's a big point for all of us, whether it's with a parent, a partner, a child. Being able to work on interpersonal relationships is something that's beneficial to all of us. And just finding that sort of sense of self, building your self confidence, building self esteem. It can be a useful resource if you're looking into a career change, if you're feeling support in a different transitional part of your life, if you are just working on goal setting in general. It's just a wonderful outlet and space for you to sort of process and have a place that you can sort of navigate whatever it is that's important to you in that moment.
I think that's a great point to add, that we all have so many people that we might feel like we have support systems for XYZ, but
Mhm.
this is really one of the few opportunities in life to have a relationship with someone that
Mhm.
their level of support to you is not based on your level of reciprocity to them. This is truly a
Right.
relationship where you get to be the person who receives support without really having to give anything back to your therapist. Like, this is just a space for you where you don't have to feel like you might be like dumping on a friend who doesn't have the capacity to hold what you have to process. And I think that's just a really rare experience in life, to not feel that need for reciprocity in that way.
Agree.
Yeah. So with all these things, like, who can be a counselor? Like, who do you go to find counseling? And that can actually be a kind of tricky question. There's all these letters after people's names. And Leslie, I think you said it really beautifully. So I'm going to let you take this.
Okay. So we kind of talked generally about this. There literally is so many letters you could find, the whole alphabet as far as like credentialing. So we sort of isolated and picked a few that were the most common. Program that we're in with clinical mental health counseling is LCMHC. So if you see that after someone's name, that simply means they are a licensed clinical mental health counselor. And what that means is they have a master's degree and they've done, advanced coursework in clinical practice to prepare for that position. They've taken a board exam. So that's part of their qualification. Um, Likewise, one that you'll see, and this was actually new to me, several years ago when my mom was receiving hospice care. She had an LCSW, a licensed clinical social worker who sort of helped us make that transition. And she was a wonderful asset and support for us through that process. So she was a person that provided counseling to our family. And that is someone also with an advanced degree who has studied and done clinical practice to prepare for providing therapeutic services. Another one that you might see is an LMFT, a licensed marriage and family therapist. And just an interesting side note on this, although those folks are trained in marriage and family counseling, my daughter actually sees an LMFT, an individual counseling scenario. So they are also, that's an advanced degree where they are equipped to provide counseling services. And it gets a little bit confusing after that, as far as like thinking about like clinical psychologist. Remy and I were sort of talking about how to bring that up because I think it can kind of be overwhelming, but we sort of left it with like there are some psychologists that are more research based, and then there are some psychologists and some psychiatrists who provide counseling. But for the I guess, point of our conversation, we sort of focused on people that were in our neck of the woods. And that's, the ones that I just went over as far as credentials, they are all advanced degrees and they have done clinical practice and they have taken exams so that they are prepared to provide those services.
Absolutely. So well said. And I also think it's worth noting that we've kind of been using the words counseling and therapy
Mm.
interchangeably. And really at this point, they are interchangeable. Counseling and
Mhm.
therapy both provide a therapeutic space in a safe environment to process, to improve your mental capacities, to help you build your own kind of emotional and mental
Mhm.
toolbox to handle whatever life throws at you. So those terms, even though they sound a little different, are actually very much encompassing of the same kind of process.
And I left off the National Certified Counselor. We had that on our list too. But
Mhm.
again, under that same sort of umbrella, mental health care provider, I think is a great way to talk about it. Sometimes you'll see psychotherapy, counseling, therapy, as Remy said. But essentially, you just want to make sure that the person that you see is qualified, meaning they have a master's level degree and they've done coursework and practicum clinical exercises and courses to be prepared, and then obviously taking their exam. I think I
Awesome.
covered that.
I think you did a great job. Uh,
Mouthful.
in the process of finding a counselor, that can also look a bunch of different ways. Typically, you're
Mhm.
going to schedule a consultation first. Again, I've left the house call counseling website there where you can, again, schedule a consultation in under a minute. With Leslie or I, other interns there, or people who are fully licensed under house call counseling. But your first step is typically going to be a consultation. That's kind of, would you like to schedule? What's your schedule like? How can we make it work for both of us? And does it feel like a good fit kind of right off the bat? And then next in the process, typically you're going to do an intake. So that can take one session, it can take a couple of sessions. Part of that is going to depend on how much you have to say and how your counselor specifically or your therapist wants to go about getting to know you, because really in those first few sessions it really is about building a relationship, and us as counselors really focusing on how can I get to know different facets of what's going on with you, what's going on for you, like where did maybe some of these things come from, so that as we continue to grow and deepen that therapeutic relationship that we have kind of solid blueprint to go on
Mhm.
of how we can even ask more questions based on a certain life experience, or I know a time in someone's life, through that getting to know you process, which again can vary by counselor, but typically those intake sessions are going to look a little bit different than kind of the meat of the work, or like kind of getting into that deeper therapeutic process. Anything you want to add to that specifically?
I think you said that really well. So I was just thinking the same thing. The first few visits could easily just be that sort of feeling each other out. I think like you're kind of interviewing them, they're interviewing you. There's a lot of questioning that goes on just to sort of get a feel for what you're looking for. And I think in, human nature, it takes us a little time to sort of let our guard down and be our authentic selves. So my, I guess, word of advice would be like not to be discouraged if you don't feel like something initially in that first visit or a consultation, to give it, a few tries. And on the same note, kind of trust your instinct if it doesn't feel like a fit. And then, just like Remy said, you're going to be, as a client, you're going to be asked a lot of questions about yourself, but also don't be afraid to ask questions of your therapist. I think any healthcare provider worth their weight in salt is going to encourage you to be an advocate for yourself, and they're going to welcome questions. And so some of the things that you might ask are, what is your background? What is your experience? What populations do you tend to work with? What is your theoretical approach? How do you come to your clients? Like, what is your lens that you're looking through, so to speak? Um, and then just on a very basic level, because this is something that is relevant to many people, is ask if they take insurance. Maybe they're only private pay. That might be cost prohibitive issue for some people. So I think just being really open and transparent about, what you're looking for in a provider, and then also being able to ask sort of where they're coming from is a great way to sort of take down that wall and just start building that connection.
Yeah, and that can feel, it sounds a lot easier than it can feel sometimes. And
Yeah.
that can actually kind of be like a little, maybe not a red flag, but a yellow flag is if you feel like really uncomfortable talking
Hmm.
to your therapist, not just on a, maybe therapy feels a little bit uncomfortable, but if you just really don't feel like a connection to your therapist, if you're not feeling like it's a safe space for you to be able to communicate or to advocate for
Hmm.
yourself, that might be one of those circumstances where it's okay to just do your couple of intake sessions, catch the vibe of the room and see if it
Hmm.
feels right for you, and if not, try another therapist. It doesn't mean that therapy isn't right for you, it just might mean that you haven't found the person that's going to
Hmm.
be your greatest fit. And as professionals, we try not to take that personally, right? that
Right.
that's not every person is going to be every person's cup of tea, in the
That's right.
same way that there are some people and populations that might really vibe with me, work with me well. There are going to be other people who aren't going to think that that's
Hmm.
cool. They want maybe to work with somebody who sounds more like them, who looks more like them, who has more
Hmm.
similar life experiences. And this is a service that's meant to be for you. This is not about trying to make your counselor happy or try to, make fit into their box. This is something that's provided to you that should be, the benefit should be focused on who
Hmm.
you are and how you feel. And through all of the research that's been done into therapeutic relationships, so much like 50% of the therapeutic outcome, the positive therapeutic outcome for a client is really based on their relationship to their
Hmm.
therapist. If you feel comfortable, confident, held in that space, your likelihood of positive outcome through therapy is going to be much, much higher than if you feel uncomfortable or just kind of put off in that space in
Hmm.
general.
And I think it's worth noting too, Remy, just kind of reminded me as you were talking with referrals, there may be a time when you go to someone and what you're looking for might be out of their scope of practice, or they might have something that seems like it would be a better fit for you. That is something in the professional capacity they should be willing to provide for you. That's part of our ethical and legal obligation. If someone comes to us and they're a different level of acuity than we're prepared to deal with, or they are dealing with something that we are not, um, we don't have competence in, it's beholden to us to find them a referral. So don't be afraid to ask for that too, and just like Remy said, have open conversations and be feel like you can express your needs openly.
Yeah. So with that too, like we might be counselors and we might be good with people, but we're absolutely not mind readers. So
Hmm.
being able to have that confidence to advocate for yourself, to speak
Hmm.
up for what you need, to even say like, hey, like that thing that you said kind of felt like it hit me the wrong way, and
Right.
being able to have that, because really unless we know that you've actually told us and we've received that information, we're kind of just going with where you're at. So
Hmm.
being able to have that openness and feeling like you can have that discourse doesn't necessarily mean that there is discord. you know
That's a good point.
Yeah. So, how do you know that it's maybe time to find a different counselor? We kind of hit on that a little bit, but I think that really the main point is, do you feel like you're getting benefit from this therapist,
Hmm.
particularly, right? Like maybe you can see that maybe therapy could work for you, but you're kind of feeling like this one person maybe isn't, scratching that itch for you.
Hmm.
That's okay. And maybe that is just the time to find another person to work with you.
So I can add a little personal story into that. I had a therapist for like 15 years that I would see, periodically on and off. And I really liked the work that we did together. It was a great place for me, like Remy said, just to process and bring whatever was on the table, that time in my life. But our lives kind of started merging in weird social ways. Um, and I noticed when I would go into my sessions that I felt compelled to sort of edit and not share certain things. And I would start like having questions like, is it okay to say that? And then what was sort of my own yellow/red flag to myself? It was like, okay, I'm not getting, what I need out of this. I think now that I have been through some of these classes, it was probably her responsibility to maybe either not have that mutual relationship or to at least address it. But I just essentially said, look, we were kind of working together in different realms. And I just said, I just need that to be our relationship. And I ended up going somewhere else, which has turned out to be really wonderful. But I think too, just not being afraid to say like when something's not working. And certainly, if there is any type of like egregious behavior where someone says something offensive, makes you feel uncomfortable, um, you know, does anything that is inappropriate, for sure that needs to be noted and dealt with in a way to get you out of that situation. And then also, I think just in the general terms, being in a space, feeling welcomed, feeling like you can speak freely, having that sense of safety and trust in the relationship. Just the sort of basic feelings like when you go there, you feel like, you welcome there as you are, your authentic self. I think that's like the number one thing is sort of trusting your gut on that and knowing. And then also just logistically, um, do you feel like you're sort of working in a way that is helpful?
Yeah, absolutely. So, with that and finding somebody, say that you found somebody that you really, enjoy working with, you feel like you've made some pretty good strides. Like, when do you know when to stop counseling?
Mm-hmm.
So that can be again like a not one size fits all answer to anyone, but
Mm-hmm.
part of it's going to depend on why you went to therapy in the first place. Like if
Mm-hmm.
you went in with a particular goal, or you wanted support through a particular transition and you've kind of made it through that transition, and you don't feel like you need that level of support anymore, that could be one reason that you
Mm-hmm.
maybe would want to leave counseling, or terminate the experience of that counseling block. Maybe you'll
Mm-hmm.
pick it up at some point later down the road, but that could be one reason that you may stop counseling. um, Anything else that you want to add?
Well, I just say too, I think that one thing to kind of look for too, I think a counselor should be asking you for feedback. And so that's kind of a green flag for you as a client, whether they're checking in, with each session or just periodically saying, like, how was this? Are we, meeting your needs? That's definitely something I would recommend looking for, just as you move into the relationship.
Yeah, absolutely. And then understanding too that like the termination of the counseling relationship might not look like a hard stop. It
Right.
might look more like I was seeing my therapist every week for a few months while I was dealing with like the
Hmm.
major points that I wanted to get addressed during that. And now maybe I see them only, once a month or once a quarter for maintenance to kind of
Hmm.
check in, be like, hey, a lot's happened in this last few months. And it might not feel like oh my gosh, I can't wait to go to therapy. I have so much to
Right.
say. But it's also, I think, a nice reflection point of being able to, go back to that safe space that you did some of that processing in, and have that mirror of your
Hmm.
growth, and to be able to again process in that space that you've done a lot of healing, and
Hmm.
almost reflecting on your growth and your experience over a period of time. So termination doesn't always mean like we're never going to see each other again, or like call me if you need me in a year, or whatever that might look like. But it can also kind of continue, just less periodically.
Hmm. Yeah, I agree. And I think, in my own personal experience, that's typically how I would work as, I would probably go for once a week, maybe, 6 weeks and sort of get things to a place where I felt like they were manageable. I had some tasks that I could work on and then, may take a break for a little while, always with the caveat, like, my therapist would say, I'm here, just let me know. And then, when I felt like I needed to touch base, I would just shoot an email and we would get something scheduled. So I know that's one way that it can work. It could also be, some people just like to schedule out, like I'm going to go every Thursday at 9, and just have that on my calendar. Um, you know, Personally, I really look at my therapy like a form of self-care. And so for me to have that on my calendar, um, It's just like a little beacon, you know, it's a thing that I know where I can land. Like Remy said, there's a lot going on, but that is a space, that is an hour that is just for me. I'm not meeting anyone's needs. I'm not taking care of anything. I am just there. And I will be honest, a lot of times I might say, I'm going to go in, I need to talk about A, B, and C. But when I sit down, like D, E, and F come out, you know, it's like I didn't even know that was on my mind. So I think just the safety that's been created in that space through this relationship with my therapist, just it's really an asset in processing all aspects, you know, of life.
Yeah, absolutely. So we kind of like touched on the aspect of how to advocate for yourself
Hmm.
in counseling, and that might look like saying, I'm kind of feeling like we're addressing this thing that I really wanted to
Hmm.
address, and you might bring it up with your counselor, or your counselor might bring it up with you of, how are you feeling about termination? Like, how do you feel about
Hmm.
that? And having that be an open conversation. And if you're like, I don't feel like I'm ready for that, that's a valid answer. If you feel
Hmm.
like, sounds good, I feel like we've kind of covered the thing that I was here for, and move on, that's also
Hmm.
great. So anything else about self-advocacy within the therapeutic relationship?
I think I just had a note in there to mention, you know, sometimes therapists or counselors might use a scaled questionnaire. They might use a form of written feedback. They might ask you in conversational the end of the session or at the beginning of a session that you kind of summarize what you've done before. Those are just some different methods that can be used to touch base. But again, they should be checking in with you to sort of get a feel of whether or not you guys are touching on the topics that are important to you.
Absolutely. I think that's, again, a green flag, checking in
Yes, green
every,
flag, exactly.
periodically, like even if it's maybe not every single session, although that's also super valid and a great way to kind of
Hmm.
scale between sessions, and even like from the beginning to the end of the session, it can be done a lot of different ways. But, someone who's not checking in with you of, are you getting your needs met? Do you feel like, we're on a path that feels like where you want to go? Because, with all of the different types of counseling that there are out there, I think that one of the more, modern approaches really is kind of through this person-centered approach, which is
Hmm.
acknowledging that you are always going to be the expert in you, that no one can know you better than you know yourself. So, a therapist or a counselor thinking that, they have the answers for you, or that they're ever going to have more data on you than you have, that would be, orange red flag. Like that would not be something that I would necessarily think would be a really collaborative therapeutic relationship. And the the theories and the actual techniques can vary very much between
Hmm.
different therapeutic lenses, and how your therapist or counselor like sees the process or the world, or what kind of resonates with them, because counselors are people too, and we're all going to kind of look at things differently, and different things are going to make sense to us in a deeper way, or resonate in a way that we're like, wow, yeah, this like makes so much sense to me. And in that, every counselor, even if they have a similar lens or a similar belief or ideal of how to approach counseling, is is going to always like do it differently, right? Like, you are the
Hmm.
special sauce that makes you you, and we may all have a similar recipe, but no one's ever going to do it the way that you do.
Right. Um, just to piggyback on that, you know, Remy and I sort of talked about this in preparation about, you know, there may be this idea of I'm thinking of the sitcom Frasier. If any of you are familiar with that, but the idea of, you know, Sigmund Freud and the traditional psychotherapist, where they're sort of sitting there like really stern with their notepad, and they're not really looking at you, and you're laying on the couch, just sort of free association. I mean, certainly that still exists, but to Remy's point, I think there's been sort of a shift overall in the therapeutic approach where it has become much more collaborative in nature. And I think that, you know, the psychotherapy approach can be really intimidating for a lot of people because, you know, maybe that feels uncomfortable to sit there and sort of talk about your deepest, darkest secrets. And certainly with some of the newer techniques that have evolved over the years, there's lots of different approaches. So if that's not your cup of tea, there's probably, you know, theoretical approach or a practice out there that is more suitable for you. But I think that that is just something that, you know, that people might have in the back of their heads. And I think it's changed a lot over the years.
Absolutely. And being able to kind of like pull from different areas that makes it, again,
Mm-hmm.
that's like what makes it the special sauce, right? It's like we have
Mm-hmm.
all of these different theories and all of this different data on like this theory works and this is like empirically
Mm-hmm.
proven, not necessarily proven, but empirically backed data that this is a great way to solve XYZ problem. And that may be absolutely true, but the way that every therapist approaches that is going to be their own. It's going to
That's right.
be different from, even one counselor to their different clients. That's going to look different because every relationship is its own special thing. And you can't, copy paste on every person. That's just not the way that our human experience works.
That's right.
So kind of with the different approaches that you can have, some of them might be a little bit more confrontational than others. Like your therapist may like probe you and ask you questions that you're like,
Mhm.
oh, I didn't really like think about that, or I'm not sure if that's exactly where I want to go. And totally advocate for yourself if that's like if your therapist asks or wants to go in a direction that you're not comfy going, like absolutely say that, but also kind of bringing up the difference between what is it to be uncomfortable in counseling and what is it to have that not be a good thing,
Mhm.
right? And Leslie and I, having this kind of yoga background, have made the kind of analogy of like if you're in a yoga posture or you're doing a workout, there's a difference between the discomfort of work, right? Like working out is hard,
Mhm.
and this is kind of like going to the mental gym. Like some things might bring you some discomfort. It might make you kind of have to come face to face with some things that you've been purposefully or not purposefully ignoring for years that have kind of built up. And that process can feel scary. It can feel vulnerable. It can be uncomfortable. And knowing that that is a safe space is the number one way that you'll be able to get to those uncomfortable places and then sit there with your therapist while you're, processing through that discomfort. But also recognizing that if you're truly in a place of like, this really isn't working for me. I feel like this is, it's taken me out of this experience or is causing me to feel worse than I did before, that's also something to address. But I think that most people with some awareness and some honesty can kind of come to that place of, am I uncomfortable? Am I just uncomfortable right now? Or is this truly something that doesn't feel right for me?
Right. That was beautifully said. I totally agree. Like there's challenge, yes. Something that's not right, not okay. So paying attention to sort of your intuition and how you're feeling in that, and if it's something you want to do. And also, like Remy said, if it's something you're not ready for and you express that, your therapist should be a-okay with that and say, that's something we can circle back to if and when there's time that you want to visit that. But if not, they definitely should not push you into that space that you don't want to go.
Absolutely. And again, it's this is the collaborative relationship. This is the
Mhm.
ability to feel safe to say, like, I don't really want to go there. This isn't about
Right.
pleasing your therapist. This isn't about
That's right.
doing, there's no such thing as like a bad client. Like, you can't fail at being a therapeutic client, really, unless you just like, I don't know, quit or try to attack your therapist. That's probably not the greatest option. But really, it's all your pace. It's all about what it is that you want and how your
Mhm.
therapist can help you and support you in that.
Mhm. And just to kind of follow up with that, one of the things that Remy and I talked about is with the sort of progression of different techniques and theoretical approaches, there can be so many letters out there that denote different types of techniques. And we pulled just a few that we've talked a lot about in our own studies that seem to be sort of having a moment right now. One would be CBT, which is cognitive behavioral therapy. And then also DBT, which is dialectical behavioral therapy, and then ACT, which is acceptance commitment therapy. And so these are all different techniques in their approach. The point I guess I want to make about it is some of these approaches are more goal oriented. They might be dealing more with specific like thought processes that you have and how to manage those versus like tell me about your childhood kind of approach. So that is just to be said so that people know there's sort of a different approach if that's not your cup of tea, to go like, lay on the couch and sift through the detritus of your childhood. There's these new approaches that have sort of evolved from the traditional psychotherapy that can be accessible to, a large population. And with that being said, that would probably dictate maybe the duration of your therapeutic relationship. It would dictate how each session looked, whether you would have homework, exercises that you do with your therapist, and so forth. So, just, those are the kind of questions that you would want to ask if someone's approach is CBT and you're looking, on working on some childhood trauma, that may or may not be a good fit. Likewise, if you don't want to talk about the past and you go to a psychotherapist, that may not be a good fit if they practice in a traditional fashion. So, it can be a little overwhelming, I think, sometimes when you start spouting out all of the letters and like, what is this and what is that? But I think that's where asking questions is really important, to get information, to advocate for yourself and what you need.
Absolutely. And I'll just kind of like highlight those like really important points again, that really if you are interested in therapy, but you're disinterested in being like, I don't want to spend a lot of time in the past. I really want to kind of focus on what's happening here and now and happening in the future, and how can I create some tools that are going to help me around that. That is absolutely a fantastic reason to go to
Mhm,
therapy. Being said that some of those little, trickle moments from the past might come through as you're kind of focusing on like, okay, so what is this thought or behavior, and maybe like, thinking about like, okay, so when did this start, so that we can kind of figure out how to untangle it a little bit, so we can
mhm,
figure out how to move forward with it. But it's not necessarily like the spotlight is going backwards and that's the only place that it's focused. So really even kind of bringing in that eclectic approach and being able to
mhm,
say like, hey, like a little bit of this and a little bit of this will help to, use some of these more goal oriented,
mhm.
strengths focused, moving forward kind of techniques. And you may still have to, pepper in a little bit of some stuff that's happened previously in order to make sure that you're getting the best benefit out of the work, and that it's one of those things that's actually going to, make the difference internally for you.
Right. That's a great way to put it.
So, Leslie, what do you think about telehealth versus in-person therapy?
So funny that you ask on our Zoom call. So this is such an interesting point, and we've all enjoyed, I think, discussing all of the differences in telehealth versus in person. I think the pandemic sort of made this a new real, part of our daily life, for many reasons, whether it's work, therapy, even medical visits with doctors. Um, you know, I love seeing people in person. I think there's a lot to be said for body language and reading the room and sort of feeling the energy of somebody, creating that space of comfort, so someone can come in and relax. However, that being said, there's a lot of benefits to telehealth too, and that may be a client's personal choice. So for me, personally, I think it is another way for people to access mental health care, and maybe people that wouldn't otherwise have that option if they have limitations with mobility, if they have, limitations with transportation, if they have, a work schedule that doesn't permit, um, you know, I think it's a great way to make it approachable and accessible to a broad population. Um, I have friends that prefer to do telehealth appointments. They don't want to go in person. So I think, that's important to acknowledge as well. How about you, Remy? You've been doing quite a bit of that.
Yeah, so having done both, I've seen a therapist in person, and I'm currently seeing someone who's a telehealth therapist, and I'm providing telehealth services. I have to say that like I haven't seen any negative outcome from telehealth. I think that that therapeutic relationship can be just as strong,
Hmm.
and in some ways more accessible, even time wise. Like I'm thinking
Hmm.
about like the schedule that I hold right now. It would be
Right.
really difficult for me to commute to somewhere and then commute back and, incorporate the time of the actual appointment, etc. And that some people are going to just feel more comfortable being in that kind of processing space,
Hmm.
especially if they're going to, maybe think about something that's a little bit uncomfortable to think about,
Hmm.
being in their own home, being, on their couch, in their room, like wherever that space is going to feel most comfortable. but truly, like, it is the choice of the client, like
Right.
choosing what is going to work best, you know, for your time, for your mobility, for you in general. What are you going to prefer? And
Hmm.
truly, I think that's one of the best things that has come out of the pandemic, is that it's allowed us to, have more access to
Hmm.
more people, and to be able to bring the counseling to them versus them having to go and find, like, physically find someone.
Yes, I agree totally. And I think too, if you are a future client of telehealth, I think what my one maybe little tidbit of information, and this is just something that we're sort of learning as providers of telehealth, is that, as a client, you still want to give yourself that confidential space to process and to be one-on-one with your counselor or your therapist, trying to sort of clear the space of distractions and treat it just like if you were in person, making sure that you are able to, focus and have what you need to be present in that space.
I think that that's a great point. And as your provider, as a provider of telehealth, we are always cognizant of that as well, making
Yes.
sure that, I just prefer to wear my headphones because I can hear better out of them. But if there was, anyone else in my home, that I would always have headphones in to ensure that
Mhm.
anything that you said remained confidential in that
Mhm.
space, and that we are on the opposite side from the client, also considering the implications of what it could mean to,
Mhm.
be in a home office versus in a building with an office space.
Mhm.
So, kind of last little point here, and then we're going to open up the floor for some questions if anyone has some. What are your thoughts on group versus individual therapy?
Yeah, so this is another way that counseling might be accessible to someone in a not one-on-one basis, and that could be, group counseling. We are just surrounded by so many opportunities to work in a group, whether it's a support group, a self-help group, even like an experiential or a counseling group. Um, I think there's a great benefit to that. I can see definitely working with clients individually and then suggesting that as additional support for them to find, community support. I have utilized that myself. I'm going to a group in addition to individual counseling. And I think there is a wonderful benefit from that. It's a great way to learn. You are in community with people maybe dealing with similar issues. And so that can be comforting, but it can also be very educational to see how people process similar challenges in different ways. Um, there are certain situations I think, group therapy would not be appropriate. Like if someone was a high acuity case and dealing with, some severe mental or psychotic disorders, that may not be a good fit. And then, likewise, there are times when I think, group might be better than individual. If there was someone who didn't feel comfortable with the one-on-one and maybe they were a little more reserved and kind of wanted to tiptoe into the idea of mental health. So I don't know. What are your thoughts, Remy? I think I think both are great and have a purpose.
Absolutely. I think that, there's the space for both, and particularly for what a person is dealing with. I think that a group can be a fantastic way to recognize that you're not alone in
Right.
whatever may be going on for you, particularly if you're looking for, a support group for a specific topic, like,
Mm-hmm.
new mothers or divorce, or,
Mm-hmm.
a specific life change, in which that every person going to that group is going to have that thing in common, and to probably be dealing with some similar thematic elements of why they're there, and
Mm-hmm.
being able to experience the community, yes, but also the safety in knowing, like,
Mm-hmm.
oh my gosh, like, I thought maybe I was the only one who had this thought,
Mm-hmm.
or I was the only one who was feeling like this. And I think that even just knowing that you're not alone in something can create a space where you do feel a little bit more confident to maybe share your own experience, or then maybe you are interested in more individual counseling to kind of uh, go a little bit deeper into
Mm-hmm.
some of those things as well.
Yeah, I agree totally.
Awesome. Well, Before we open up the floor to questions, I also just want to make sure that everybody knows that in that chat box, there is the House Call Counseling website. It is super easy to schedule a consultation, to select a therapist that you feel like, might be a good jumping off point for you to go to. If you're in Catawba College, there's always that student health resource that you can use and utilize if you're looking for someone to talk to. And does anybody have any questions? Anything that they want to bring to the space? You go ahead, Lashika. Yes, ma'am.
Ladies, first of all, excellent questions and answers. Your presentation was great, but one of the questions that I know that we run into is a barrier for some of our families, and that's finances. Could you speak a little bit about if a client or a person seeking counseling does not have insurance, what does that look like when they know that they need the help? And or what are their options? I guess that's what I'm asking or what I want to put forth.
Absolutely. That's a great question,
That's
Lashika.
such a good
And
question.
yeah, so that's something that Leslie and I are working a lot with right now through House Call Counseling, is supporting people who need sliding scale mental health counseling. One of the ways that you can kind of make sure that you're in a place that you are finding somebody that's going to fit your needs is just straight up asking, like, what do you take insurance? If you don't take insurance, like, what are the costs? Like, what does that look like? And finding someone who's going to be able to fit within what it is that you need. And also knowing that seeing an intern actually could be a real benefit to you at that point, knowing that the fees for seeing an intern are always going to be less than seeing someone who's fully licensed. Leslie, do you have anything to add?
I think that's perfect. So I think Lashika, first and foremost, ask, because even if it's not necessarily on the website, many providers will offer a sliding scale payment for those seeking services that may not have insurance or be able to pay, the full fee. So just finding out like what their stance is on that. And then also just working through a program like House Call, where they utilize interns who are working under a supervisor and able to provide that service for free or at a discounted rate. That's a
Absolutely.
great question, and a great a need, that we currently are seeing right now with so many people in need of healthcare, mental health care.
Absolutely. So we got a
So
question
Nolan has,
over.
did you
Yeah,
see
go
the one
ahead.
in the chat room? Okay, so do you have advice for those wanting to try counseling again after previous attempts didn't work? How can I get back into a space to be vulnerable and comfortable in that setting again? That's a great question as well.
Absolutely. And part of that is going to be, do you feel ready?
Mhm.
Sometimes, like, even, bringing it back into, like, if you've gone through a hard breakup, maybe it's not the time to start dating again quite yet, and to
Right.
to give yourself a little minute to let that settle down. But especially if you're kind of like hearing that little voice in your head, like maybe it is time to seek some help again, understanding that the first therapist that you see might not be it. You might need to
Mhm.
to shop around a little bit and kind of think of it almost like, they're interviewing you, but you're interviewing them.
Mhm.
You're there to see if it is a good fit. And I also would say, like, I just, my heart goes out to anybody who's really like gone so far as to try to seek help and then had a negative experience with that, because it takes so much courage and vulnerability to be there
Mhm.
in the first place. And then to feel disappointed within that space would, absolutely bring up a lot of feelings of, disappointment. And, is this even the right thing for me? Like, will therapy work at
Mhm.
all, even though I, have this one negative experience? Sometimes it can be hard to focus on any of the possible positive experiences you could have in the future, or even some benefits that you may have gotten before that negative experience.
I agree with Remy, and to sort of like overlap this answer with part of Lashika's too. One way to provide counseling is through the group process. That can make it more affordable at times, and that might be like a better reentry point if you've had a bad experience, to try it from a different angle and maybe get some feedback from people, or other healthcare providers that you know and trust, who might be able to talk to you about what happened in your previous experience and sort of guide you to a new person. I would say definitely, yeah, take time and maybe sort of be clear about what you didn't like or why it didn't work out before going back. And then either trying a different approach through group or getting a reference from a healthcare provider.
Yeah, I think that what you said is a really good thing to consider as well. Is like what was it about it that didn't work for
Mhm.
you, and
Yeah.
understanding that so that you can communicate that, right? That's
Mhm.
something that, again, we're not mind readers, but if you give us this information and say like, hey, I had a really negative experience with counseling because XYZ happened and it made me feel really unsafe, then we also know that that could be sensitive for you, and that we're going to
Mhm.
take the time, effort, and energy to make sure that we create this safe space where you can feel comfortable to go through this
Mhm.
therapeutic process, and again, like, try to heal some of that wound too, and knowing that you know it's not your fault if you felt uncomfortable, and
Mhm.
in knowing how and how that occurred and being able to communicate it, it will create the possibility for a more positive experience in the future, to be able to advocate for yourself and say what you want or what you don't want, or what you like or what you don't like.
And your new therapist should want to know about that, to share that experience, I think, for sure.
Absolutely. All right, anybody else have any questions?
Yeah, if you guys don't mind, you were speaking about, the alphabet soup after folks' names. I have family members that will only look for doctors,
Mhm.
like somebody with that PhD or an ED. Like they have to be a doctor, somebody for them
Mhm.
to feel comfortable. So I was wondering if y'all could speak to, is going to somebody who's a doctor better? Like y'all are interns. Like what does that difference look like?
That's
Absolutely.
a
I
great
think that's a
question.
great question. You go first, Leslie.
Okay, so, looking at that, I think that, we think of psychiatrist, which is a medical doctor, and so you would see Doctor so and so. Um, and so we sort of have that model of, and again, that's sort of the Freudian model, I think, of what therapy began as. And I think it's evolved into, something that's very different. Certainly, there are people with a PhD that provide counseling, like some psychiatrists provide counseling, although I think the large part of it is just, medicine and managing that part of treatment. However, I personally, I have seen both. Um, sorry about that, my dog. Um, I think that's a personal choice. I think it depends on what you're looking for, and what the training of the person is. That would be the most important factor for that. Um, I don't think it necessarily matters, doctor doesn't necessarily equal better for what you're looking for, but I think that's something that definitely is a personal thing to look into based on what your needs are.
Yeah, so being able to see somebody who has kind of the alphabet at the end versus the, doctor at the beginning, breaking that down means that, some of those people that you're going to see have their masters, specifically they're done their masters in counseling, and they may have, extensive experience within the counseling realm, whereas Dr. So and so went to a doctoral program to do research in an area
Mhm.
that may not be beneficial to you at all. If you
Mhm.
see somebody who was in their doctoral program and studying child psychology, and you are not a parent and you're not a child anymore, and you want to see somebody who might be more focused in eating disorders, that
Mhm.
person may not be the person for you. And on kind of the devil's advocate of that is, if you
Mhm.
really do need someone who's going to be a specialist, who has way more research experience, who can speak more directly to an acute problem such as an eating disorder
Mhm.
or a particular mental health concern, then that might be a reason that you would see somebody who has a PhD in XYZ. And seeing an intern really means that you're open to the experience of knowing that we might not know everything all the time.
Mhm.
And by the way, having a doctorate degree doesn't always mean that you know everything all the time either. So that we're all humans in this human experience, but that seeing somebody with a master's degree it's not necessarily any less beneficial than seeing somebody who's gone through that doctoral program and done research in a particular area.
And that's a great point to follow up on. I think too, we can work with other providers. So if it is a client who is in need of, some psychopharmacology and they are on medications, we certainly want to be in touch with the who's prescribing, whether it's a primary care physician or a psychiatrist. And to Remy's point too, I always remember one of our professors, saying he knows plenty of people with doctorates who aren't great counselors. And he knows plenty of people who hold master's degrees who are like excellent counselors. So I don't think one thing, precludes the other as far as like level of service, but it's just a very individualized fit based on your needs and what you're looking for, and also, what the person is qualified in, whether it's research or actual like, clinical psychology. Great question.
Anything else before we close out? All right. Well, thank you guys so much for showing up and being here with us this evening. Again, if anything we said resonated with you and you do feel called to, book a consultation or reach out to House Call Counseling, that link is in the chat box there. And we look forward to answering any other questions that you may have in the future. You can always get in touch with us through that website. And thank you so much for showing up.
Thank you guys for spending your evening with us. We really appreciate it.
Bye.
Bye.